This is the Spring 2015 Review of Practices for Hand Hygiene in the Perioperative Setting. This presentation is for use supplementary to facility and departmental policies, guidelines for perioperative practice, and manufacturer's instructions for use. After this presentation, staff will be able to identify proper hand hygiene practices appropriate to their job role, identify when hand hygiene should be performed, and demonstrate proper techniques for first of the day and surgical scrubs if required for their role. Proper hand hygiene is the most effective way to prevent the spread of infections in hospitals. The purpose of hand washing is to remove soil, organic material, and transient microorganisms from fingernails, hands, and forearms, decrease the resident microorganism count to a minimum, and to inhibit rapid rebound of microorganisms. Healthcare personnel should keep natural fingernails no more than 1/4 of an inch. The subungual area of fingernails has the largest number of microorganisms on the hands. Any fingernail enhancement or resin bonding product is considered artificial. Rings should not be worn by healthcare personnel in the perioperative setting, and watches and bracelets should be removed prior to washing hands. The term hand hygiene is used to describe all measures related to hand condition and decontamination. Decontamination of hands can be done in multiple methods. Hand decontamination should be performed upon arrival at the healthcare facility, before and after every patient contact, before putting on and after removing gowns, gloves, PPE, anytime there's a possibility that there has been contact with blood or other potentially infectious materials, before and after eating, before and after using the restroom, before leaving the facility, and when hands are visibly soiled. After contact with inanimate objects, including medical equipment in the immediate vicinity of the patient, and before and after administering medications. Hand washing with soap and water must be done when hands are visibly soiled or contaminated with blood or body fluids, after using the restroom, or if had contact with spores, examples bacillus or C. diff. Hand washing with soap and water should be performed in the following order. Remove jewelry from hands and forearms. Adjust water to comfortable temperature. Wet hands thoroughly with water. Apply facility-approved soap and rub hands covering all surfaces, including backs of hands, fingertips, interwebs, and palms. Wash for a minimum of 15 seconds. Rinse well to remove soap. Dry hands thoroughly with absorbent disposable towel. Use disposable towel to turn off water and open door if hands-free controls are not available. A surgical hand scrub should be performed by healthcare personnel before donning sterile gloves for surgical or other invasive procedures. Use of either an antimicrobial surgical scrub agent intended for surgical hand antisepsis or an alcohol-based antiseptic surgical hand rub that has met FDA regulatory requirements for surgical hand antisepsis is acceptable. The use of a brush for surgical hand scrub is not necessary for adequate reduction of bacterial counts. Scrubbing with a brush is associated with an increase in skin cell shedding. Studies of duration of surgical hand scrubs showed 3-minute scrubs are as effective as 5-minute scrubs. A traditional scrub. Remove jewelry including rings, watches, and bracelets. Don surgical mask. If visibly soiled, pre-wash hands and forearms with plain soap and water. Clean subungual areas of both hands under running water with disposable nail cleaner. Rinse hands and forearms under running water. Dispense approved antimicrobial scrub agent according to manufacturer's written directions. Apply agent to wet hands and forearms using a soft, non-abrasive sponge. A 3 or 5-minute scrub should be timed to allow adequate product contact with skin. Visualize each finger, hand, and arm as having 4 sides. Wash all 4 sides, effectively keeping the hands elevated. Avoid splashing on surgical attire. Discard sponge if used. Inappropriate container. Hands, arms should be rinsed under running water in one direction from fingertips to elbows as needed. Use of alcohol-based surgical hand rub products. Remove jewelry, including rings, watches, and bracelets. Don a surgical mask. If visibly soiled, pre-wash hands and forearms with plain soap and water. Clean subungual areas of both hands under running water with disposable nail cleaner. Rinse hands and forearms under running water. Dry hands and forearms thoroughly with disposable paper towel. Dispense recommended amount of surgical hand product to hands and forearms. Rub thoroughly until completely dry. Maintaining hand antisepsis in the OR, don sterile gown and gloves. Use of Avogard as a hand antiseptic. Apply to clean, dry hands and nails. Dispense 1 pump into palm of one hand, paying attention to the spaces between the fingers and under the fingernails. Apply the lotion evenly to cover both hands up to the wrists and allow to dry without wiping off. Use of Avogard as a surgical hand antiseptic. Apply to clean, dry hands and nails. For the first use of each day, clean under nails with nail stick. Dispense 1 pump 2 mils into the palm of one hand. Dip the fingernails of the opposite hand into the lotion and work it under the nails. Spread remaining lotion over the hand and up to just above the elbow. Using another 2 mils of lotion, repeat with the other hand. Dispense another 2 mils of lotion into either hand and reapply to all aspects of both hands up to the wrists. Please allow to dry. Do not dry off with towels before donning gloves. All care directions for surgical scrub. Clean under nails with nail pick. Nails should be maintained with a 1 millimeter free edge. Dispense 5 grams tennis ball onto one hand. Spread onto both hands, paying particular attention to the nails, cuticles, and interdigital spaces and forearms. Rub until skin is dry. Dispense 2.5 grams golf ball onto one hand and spread over both hands to the wrists and rub into skin until dry. When using alcohol-based products for surgical hand antisepsis, user must rub product into skin until it is dry. Do not dry with towels. Do not gown or glove yourself or others until product is dry. Alcohol and alcohol combination hand products pose a fire safety concern. Hand washing remains one of the most important measures in maintaining patient and healthcare personnel safety. Following these hand washing practices will prevent transmission of infection and reduce healthcare associated infections for the patient and healthcare personnel.